The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen in 2024.
Happy New Year.
Happy New Year. It's our first show live back with you. So thrilled. I'm Shannon Penrod and I'm here with Dr. Doreen Granpeesheh. Good morning.
Good morning.
Can I tell you how much I've missed having this time with
I
you
know.
and with all of you?
It's been it was like it just happened that the holidays fell on certain days, so it's been a long absence, I guess.
It really has.
Yeah.
And especially because I have to send my apologies to those of you, there were so many people who wrote in and said that they were looking for that last show. And I had so looked forward to that last show for so many different reasons. We had planned to say happy birthday to Lori Bowersox from Autism Journey with Elijah, and I didn't get to do that. She had sent a card, which I need to show you. I played it on the show yesterday. It's one of those cards that you open it up, and it's Eli talking, saying happy holidays. It's the cutest thing. I got to share it with you later. It's delightful. But we had a surprise for you.
Yes.
That I was so looking forward to showing on the show.
And I loved it. It was awesome.
Well, we have the video because from my deathbed, I was like, I can't come in. And I said, can you give it to her and videotape it? And so the fabulous Sarah videotaped it, and Chris and Sarah got together. And so, because so many people wrote in and sent their messages, and then they wanted to see you open it.
Oh my God, that was
and they were
most
bummed.
Incredible thing, because I'm sure our viewers also know it becomes so stressful during the holidays. No matter how much you try, like I really tried to slow things down. I know for you it must have been horrible because you got sick around that time.
Everything stopped like a freight train in snow.
Yeah. And I've been struggling since January 1st with like my daughter having COVID and a million other things. But when I sat down that day, and I don't remember what date it was, but it was...
Yeah, it was like the 19th or 20th.
It was close enough to the chaos, where I was already like, oh my gosh, I just need to sit and relax. And then I opened this thing, and it's this beautiful, like, just pops open. I kept it because I love it so much. It's so nice. And then all of these beautiful messages from our viewers and people just jumped out, and it was so touching. It was like an amazing moment, and I just have to thank everyone because it was so meaningful. I sat and I took them home. I read them right then, and I took them home. It was next to my bed for a while, all the messages, and I read every single one for my husband who has to like go through life with me. And I'm like, look at these, isn't this so touching? And it was so lovely. Yeah, thank you so much. What a wonderful gift. Thank you.
So we have that video for you. Chris is going to play it right now.
Awesome.
For those of you who, I didn't get to be there either, but take a look. This is her opening the box.
I am opening. I haven't seen it myself.
Oh, look, everything's pink, even her
Best wishes for you. Let's see. It's kind of scary. Like, I don't know what to expect, but here we go. Okay. Oh dear, it's one of these. This is so cool. I love this. I've seen commercials for these. This is so thank you, Shannon. This is so fun.
That was awesome.
These are like letters, I think, from people. This is families. This is so amazing. Mwah. Thank you.
Wow, it keeps coming out. That's awesome.
It's so awesome. Oh my God.
Didn't quite go, because it's supposed to all just shoot out and fly out, but I think I made the papers just ever so slightly too big, because you're supposed to put money.
Is that what it, yes,
you're supposed to put money in, and I think I made the papers, but some of you wrote really lengthy things, and I was trying to make the font big enough that you could read it.
It was so lovely.
But,
oh my gosh.
It was fun
very,
for
very
me
touching.
to connect with you guys as you guys were writing things in, and so thank you everybody so much for doing that.
Thank
so
you very much. It
was
wonderful. Thank you so much.
It was delightful, fun for me.
Gift. Thank
and
you.
we did a test run the day before.
Oh, did you?
Because I was so concerned about out wasn't going to work, and so they shot out all over Sarah's office.
Oh, I see.
But I think then when I packed them in too hard, so it kind of did a pff, and then a pff, and then a pff.
It was wonderful. Thank you so much.
welcome.
It was wonderful.
Thank you to everybody. And also, you know, at that last show of the year, we usually talk about what our hopes and dreams are for 2024.
True, and we never got to do that.
We didn't get to do that, so I wanted to take just a minute to say, do you have any New Year's resolutions or anything you're particularly looking forward to in 2024?
Yeah, thank you. I appreciate that. Whenever I have an opportunity to just sit for a moment, and I have missed this hour because, as you know, like, let me tell you, it has been insanely busy.
Yes.
But yeah, I think for me personally, it's about health this year. I know that some of our viewers know we both had a milestone age last year, you and I, and so we are. For me, it's like, oh my gosh, why does everything hurt at the same time? And
Yes.
so it's really about health and trying to get more, just do the things that are meaningful in terms of health, right? Whether it's working out, eating properly, sleeping, all that sort of stuff. So that is a really big one for me, and I think maybe for you. We were just discussing that. And then I think I'm still just very excited about the changes that we're making at CARD. And I, even on the most difficult days, which I've had a few in the last week, I have much more gratitude than anything else because of the opportunity to make change. I don't, unless you've experienced it, you don't know how hard it is when you watch something you care about falling down or failing, or and then and your hands being tied. So having the opportunity to work hard and do something is very gratifying.
Yeah.
And so that's sort of my New Year's is, yes, I will continue to work hard for CARD and all of our patients. I need to do some reading and writing, which is in my plan, but mainly I want to focus on my own health.
Yeah.
Those are mine. What about you?
I mean, it's pretty much the same thing, just in different wording. Jim, years ago, when the Christmas that we were waiting to get the diagnosis for Jem, Jim gave me a present, and it was a little stone heart that on it said, "Wherever you go, go with all your heart."
Oh, how beautiful.
And it became a real rallying cry for me in terms of, okay, if it's autism, then we need to go with our whole heart.
What a
into
beautiful
that,
thing,
right?
yes.
And that's kind of how I feel this year. It's like, okay, I've sort of narrowed it down in my head. The sort of rally cry is make it count. That if I'm gonna say I'm gonna do something, then I want to go with all my heart. I want to make it count.
Yes.
But that includes, I can't go with all my heart unless I take care of myself.
That's true.
Which was really brought home to me
That's
the
very
last
true.
couple
So
of
very
weeks.
true, very true.
It's like, you can't give away what you don't have, and I can't so the biggest, this is going to sound stupid, somebody put this, I wish I could remember who it was on Facebook, but somebody on Facebook said, my big New Year's resolution is that I'm going to dance for 15 minutes every day. I'm just going to put on music and I'm going to dance. And I was like, okay,
actually.
that actually is something I might be able to do. So, what is today? I've been doing it for 8 days.
Wow.
And I have to say,
It makes a big difference.
it's a game changer.
I'm going to do it.
I
I'm gonna do it.
broke a toe during this break too, because this and so I was like, oh, I had this whole exercise plan. But the truth of the matter is if I'm just dancing and I'm not following somebody else, then I can listen to my body and not, put too much pressure on that foot. And I'm listening to music,
Beautiful.
It's like the 80s.
Yeah,
it
it's
brings
so
it all
healing.
back.
Yeah, it is. It's awesome.
And so that's been really powerful for me. And I'm really, because I've been feeling like a block of wood, like I just don't move.
I know, me too.
And so
I get it.
the other day, one of the things that I was doing, I was like moving my neck around and it was going, like it cracked like a firecracker. And I went, okay.
Yeah.
Enough with this.
Yeah.
Because I think it's move it or lose it time.
I agree. I think that's a great way to look at it. And it's funny you say that. I love the concept of just dancing.
Yep.
I can't do it right now with my knee.
But you can sitting down. That's the nice thing about it.
You can. It's true.
Yeah.
And I was just telling myself, I really have to get heavily into yoga because at our age, it's just hard to do high impact stuff, and you just need to do like very gentle stuff, and
I'm also doing a somatic thing, a somatic breathing thing.
oh, nice, very nice.
Which is supposed to be good for inflammation.
Very good. That's true. You have to teach me.
Yeah. It's an app.
Oh, okay.
Yeah.
Good to know.
So
great.
It's 11 minutes every day. It's just breathing.
That's
and a little bit
awesome.
of, doing stretches and things. But anyway, all right.
Oh, okay.
Let's see if I stick with it.
See, this is why I need to see you every week. I fall apart when I don't.
Well, listen, I fell all the way apart. Hey, we're saying good afternoon to Judy, who's thrilled that we're back, and we're saying hello and good morning, Happy New Year to Dr. Doreen from Autism Journey with Elijah. I hope you were here for the beginning because we said happy birthday to you again.
And we showed, and there was a beautiful message from you also in my presence, so thank you so much.
Yes, so much. And there was one from Judy as well.
Yep,
Judy also sent one.
Thank you so much.
So today's topic, for those of you who are just joining us, first of all, we're live right now on Facebook, YouTube, and Twitter, and about a dozen other sites. And if Chris has time, our fabulous, amazing Chris, what would we do without Chris?
Yes.
Seriously, stop. I'm so thrilled that he's back.
I agree.
He went on a journey of a lifetime.
I know.
I almost want to have him be a guest and tell us everything
all
about
it. I was so
because
jealous. It sounded so amazing. And he wrote me an email, which, by the way, was also
epic.
I was crying last
me
night.
too.
It was, but he explained this view of where he was, and I was like, oh my God, I can see it.
Yeah.
Like, that sounded so amazing.
Yeah.
Glad you did that, Chris.
Yes, we're so thrilled that you went and that you came back.
Yes. Safely.
Yes, safely, and healthy. So anyway, Chris, if he has time, he'll put up on the screen some of the different ways that you can be watching the show. The show is available pretty much anywhere you get your podcasts. You can download it. Make sure you're looking for Ask Dr. Doreen. It is a separate podcast now from Autism Live. Please subscribe to this podcast so that you make sure that you get the latest episodes. Whenever we do a new episode, you will get it in your inbox if you happen to miss the live. It's a great way of doing it. It's free to do. Subscribe to Ask Dr. Doreen wherever you get your podcasts. We also love and appreciate reviews. If you have not already done a review on iTunes or wherever you get your podcasts, would really love for you to do that. When we split Autism Live and Ask Dr. Doreen, it meant that, some people were having a hard time finding us. And if you really want to help this show and Dr. Doreen's message to get out, doing a review helps more people to be able to find the podcast. I do want to say that when you do the podcast, when you get the podcast, you will get some advertising because that's how we keep the lights on here, and that's a really important thing, and we hope that you'll appreciate those sponsors that are helping us to keep the lights on. But some of you have said that you'd like to get the podcast with no advertisement and that you'd be happy to pay for it. We set that up for you. We listened. And so for just $5 a month, here's the good news. If you subscribe to the ad-free podcast, you get both Autism Live and Ask Dr. Doreen. And you get that by going to glow.fm/Autism Live. And then you can get both podcasts and get them ad-free. So there is that. But we love and appreciate everybody who likes, shares, and lets other people know. And we also appreciate it when you join us live and write in your questions, because I think that's the most fun for us.
Absolutely.
Is when we get to, feel like we're having a conversation with you guys. So today's topic, because we had this planned for the last show and we didn't get to do it, so we said, let's do that, is talking about diagnosis. Because this is an area where everybody has a lot of questions, and it's not a one-size-fits-all, because if you have a 2-year-old and you're thinking about getting a diagnosis, or you have an 18-year-old who is in the process of getting a diagnosis, or you might be 45 and thinking, well, my significant other has said I need to go get a diagnosis, it might look a little different.
Yes,
depending on those things. So that's what we're talking about. Should I give you a starter question, or do you want to start with a statement?
Whichever.
Okay. Well, the starter question is, can a child who has ADHD be misdiagnosed? My son is ADHD and ODD. He is 8 years old, about to be 9. My son was evaluated for autism, and it was ruled out. I took my son to a new psychiatrist. He does not agree with the autism evaluation outcome. He wants my son to be reevaluated for autism. What can I do in this situation?
Yeah. So I'm so sorry, like, that you're going through this. It's just so difficult when our children are struggling and you get a whole bunch of different labels.
Yeah.
Everything that you wrote is possible. Yes, it's possible that it happens all the time, in fact, that people are misdiagnosed. Years ago, about maybe 10 years ago, you were not allowed to diagnose ADHD and autism together. Right now, you can diagnose, as of 10 years ago, you can diagnose ADHD and autism together. ODD is a diagnosis I don't like. Oh, sorry. So ADHD obviously is attention deficit hyperactivity disorder. And ODD is oppositional defiant disorder, which I just hate that diagnosis.
Me too. I'm glad you feel that way.
I've always hated it. I think it makes no sense. It's a behavioral response to something. Like, basically children who are defiant and oppositional, I think that's purely based on their environment and what they're struggling with and how they've learned to cope or communicate. But we're not going to go into that, but yes, it's possible to have all of those. Now, what you should do is you should go to someone and see someone who regularly diagnoses, because this is not, you shouldn't go. A lot of people have no choice and they go to someone who's maybe a pediatrician or who's not really been diagnosing for a long time. So there are autism centers all over the country now. You should go to someone who diagnoses, who is a diagnostician. That is less likely a pediatrician, more likely a licensed clinical psychologist. And the other thing you should do is you should make sure they test your child. So you can give diagnoses multiple ways. Like, for instance, when I diagnose, I have diagnosed for so many years now that I don't need a test to validate my opinion.
Yeah.
But if someone is new at diagnosing, they need to administer a test. And there are some really good tests. For example, the ADOS is very extensive and time-consuming, but it is very valid. And so that is a way for you to be sure whether or not your child has autism. There are other questionnaires that you could fill out that would be helpful. The CARS is helpful. There are some questionnaires, but I do think it would be helpful to you to know for sure, and someone needs to administer an ADOS. That's kind of the gold standard for testing. Now, that said, there's a lot of companies. Diagnosis has become such an issue in autism, as many of you know. I'll be moving around a lot, chatting, because my knee is a mess.
Feel free to do that.
So it's been such a big issue for so many years because the growth of autism has been so significant and throughout the world that a lot of funding went into different ways to diagnose. Right now, in the US, there are several different companies that are doing unique things for diagnosis. There's 2 companies, one of them actually has breakthrough clearance from the FDA. And what they're doing is they're diagnosing very, very, very early based on eye movements, eye tracking of children, because individuals with autism tend to look at faces and other stimuli in a different way. They look at different parts of that than we do. So that's one thing. The other thing is there's a company that is doing diagnosis with genetic testing based on one hair strand, which I'm considering working with them on that. So it's kind of very interesting that there are ways now to diagnose which are earlier and more definitive. That said, I think it's very important for parents. In the past, many years ago, I used to say, who cares what the diagnosis is? It doesn't matter.
Right.
List the symptoms that your child has and start working on them. But it does matter, and the reason it matters is that once you have the diagnosis of autism, you get healthcare funding and you are directed towards ABA typically, and that is the kind of gold standard treatment for autism. So it does matter just in terms of the direction you take. If a child is diagnosed with ADHD and ODD, ADHD, ODD, what happens is you will see a psychiatrist who will suggest medication. And by the way, I'm not against those medications. Sometimes those medications also help with individuals on the spectrum. But then you will see a psychologist and do a lot of talk type of therapy, which might not be the right thing for your child. If a child has very high functioning autism, they're really going to benefit from kind of natural environment type ABA, which is more cognitive behavior therapy, a little bit different than just, regular talk therapy. So it does matter in terms of the direction and the funding that you get.
Absolutely.
Yeah. And I should probably just go through and kind of review the diagnostic criteria for autism, right? Because you are right. The diagnostic criteria are the diagnostic criteria. And more these days, as people become more familiar with autism, and as society becomes more accepting of autism, more and more we see adults who have been functioning, maybe not thriving, but functioning, who come to us and say, I think I have autism, can you diagnose me? And so the symptom criteria then have to be broadly applied to individuals who are adults and have already had a normal life for a few years, but are struggling and they feel like life shouldn't be this hard, right? So I'm going to go through the symptoms of autism. I actually printed them just so that I wouldn't miss anything. But when I diagnose, I like to ask a lot of questions of the caregiver or parents. Usually I'm looking at diagnosing children. If it's an adult, I'll be asking them. And aside from that, I'm also observing for at least an hour, maybe 2 hours, and that gives me an opportunity to really understand a little bit better if the individual does actually exhibit all the symptoms that are required. Now, it's very important to understand the diagnosis of autism is just based on a series of symptoms. So if these symptoms exist, you get the diagnosis. Yeah. It is not based on what's causing it. And that's a very important distinction because after my diagnosis, the next meeting, I really start going more into causation and history because that affects treatment.
Sure.
Significantly, right? I mean, and that is my whole, education that I try to give behavior analysts is that not every autism is the same. You have to understand what's causing it in each individual. You have to understand a little bit more about the symptoms in each individual. But essentially, it's based on two areas that the individual is struggling with. The first area is specifically called communication and social, it's communication or social communication across multiple environments or domains. And in the past, before this version of the diagnostic manual, this section was divided into two. One section was communication, the other one was social behavior. Yeah. But now they got joined, and I think that was in 2003. It was a while ago. Yeah. I don't remember exactly when. Maybe 2013. I don't know. We're getting.
I think the 13. Last one was 2013.
13, yeah. So already 10 years ago.
Yeah.
Or 11 years ago now. So basically, the area of struggle that has to do with social and the area of struggle that has to do with communication were merged, which makes sense. If you think about it, if you're struggling communicating, your social behavior is going to be affected. Now, for a diagnosis of autism, you must meet all three of the specific symptoms that are listed under this section. All three. You must have all three. The first one is deficit in social emotional reciprocity. Social emotional reciprocity means, back and forth sharing of social behavior and emotional behavior. Now, examples of that are abnormal social approach. Abnormal social approach means, for example, you are standing extremely close to someone, or you are speaking very, very loud. So your social approach with people, or like you're talking to a group the same way you would talk to an individual, or you're talking to someone you know the same way you would talk to a stranger, and vice versa. So abnormal social approach. Now I'm listing 4 different types of social emotional reciprocity. So, right, as long as you have one of those types, you have an issue with social emotional reciprocity. Failure of normal back and forth conversation, right? So that's a given. Reduced sharing of interests, emotions, or affect. And this is kind of like a lot of our children that we diagnose have a very difficult time. They only share their own experiences if they need help. Okay, and that's kind of not the same as this. This is a very, very important part of the diagnosis, which really has to do with, you know, as a child it would be like, Mom, look at what I just painted, or you know, Dad, can you help me with this? Like, look at this thing I built. But with our kids, it's not that way. They don't share their activity with someone else, or even their emotions or affects. So like this is, you know, a child who gets hurt and doesn't necessarily run to the parent for being consoled. Yeah.
I always think of this as the Disneyland thing, that I would always look at Disneyland when the parent would go, oh, look, it's Mickey, and the child would go, oh, and look at the parent and look back, and it would be this moment where they're sharing the emotion and sharing how I feel and noticing how the parent feels.
Exactly, and that's, we call
fascinating.
That, it's joint attention, right? It's the beginning, and it's one of those things that actually develops around 9 months of age, joint attention. It's the whole concept of let's put our minds together, right? And we do it automatically in life as we grow up. And then there's failure to initiate or respond appropriate to social interactions, right? So all of those types of things, like having difficulty approaching social situations, not responding appropriately to social, not having appropriate conversation back and forth, not showing affects appropriate, all of that falls under this thing called deficit in social emotional reciprocity. So
you just have to have
That's one. Yes, you just have to have one of the examples in order to qualify for a deficit in social emotional reciprocity. That's symptom number 1 in the whole domain of social communication. Later we're going to talk about another domain, but this is the first domain, and it has 3 parts. First part is social emotional reciprocity. Second part is nonverbal communication, which I'm going to talk about. And the third one is relationships, which I'm also going to talk about.
But you've got to have all 3.
You have to have all 3, but one symptom in each one.
There we go.
So the second one that we mentioned is deficit in nonverbal communicative behaviors used for social interaction. For example, any of these. Poorly integrated verbal and nonverbal communication. So, not waiting your turn to say something. Being extremely loud with someone when you don't intend to be. Those types of things. Now, nonverbal, so we're talking about verbal and nonverbal. Nonverbal communication involves things like eye contact, right? Eye contact is a great example of nonverbal communication. If I'm talking to you, but I'm looking over there, that's very unusual, right? And you don't know that I am communicating with you. So, and a lot of our folks have fleeting eye contact, whether they're children or I see a lot of this in adults, where it's just very clear that it's uncomfortable for them to have ongoing eye contact, right? And again, abnormal eye contact and body language. Body language is also another one, because some of our children or some of our teens also, they are very uncomfortable standing too close. Others stand actually too close. There's behaviors like touching when you're not supposed to touch another person. Those types of things are all part of body language and non-verbal communication. Deficits in understanding the use of gestures. Now, gestures are very important, right? And this is it can be a normal behavior if you're very, very young. Like I remember when Charlie, my daughter, was probably 1.5 or something, and she was on the other side of the room, and she was being very cute, and I went like this, and she came up to me, and maybe she was 2, and she was like, "Mommy, what is this?" You know, and so, so children learn gestures over time, but a lot of our kids have difficulty with that. In fact, if you remember, very early on, a lot of kids, when you wave to them, they will wave
They
like
go like
this.
that,
Yeah. So those types of use of gestures are difficult for our kids. That also has a relationship with joint attention. Total lack of facial expression and nonverbal communication again. So facial expression, so all of those kind of nonverbal communicative behaviors, you have to see something different in that realm.
Yeah.
Okay. Then the third area within this domain of social communication behavior is deficits in developing, maintaining, and understanding relationships.
Yeah.
And these are things like difficulties adjusting behavior to suit various social contexts, right? So we behave very, very differently with our best friends, with the teacher, with a stranger, with someone who's a friend of my parent, you know, and a lot of our kids don't see that difference. They behave the same with all, and that's something that has to kind of be taught.
Yeah.
Different relationships. Difficulties in sharing imaginative play. So imaginative play requires the individual to know that you don't know what's in my mind. And I'm pretending something, and I'm going to now share that with you. And all of those skills that are like the theory of mind skills that are lacking kind of come into play when we do imaginative play and when we share that with someone else. So that's always a really good test to check. Difficulties in making friends, obviously, due to all the other social things that we talked about. And sometimes there's an absence of interest in peers. And as time goes by, I find that one to be less and less, because a lot of times our kids are interested in peers. There are cases where our kids are just not interested in peers. They're more interested in adults.
Yeah.
But many kids are interested in peers. They just really don't know how to interact with peers, or it's the other two.
There's nothing reinforcing about it because they can't get into it.
Exactly. They don't have the appropriate social approach.
Yes.
They don't have the social communication back and forth. So it all of those things that I just talked about fall under this one heading, which is social communication.
There we go.
So if you have to have all three of those, right?
Yeah.
A deficit in social emotional reciprocity, a deficit in nonverbal communication behaviors, and a deficit in understanding and maintaining relationships. You have all three of those.
Right.
That's 3 specific symptoms. Now it could be more.
Right.
Because you could have many under each of those. Now the second domain, the second area that if you had just what I just went through, you would actually be diagnosed with social communication disorder, which is a whole different thing.
That's an important thing to say, though, because I think a lot of times people go, well, I have that, so I must have autism. But this is one part of it.
That's right. That's right.
And you're going to tell us the other part.
And the other thing that's also important about that, what you said, is a lot of people have social anxiety.
Yes.
And social anxiety will lead to almost everything I just went through.
Yeah.
So when you have social anxiety, you avoid people, you don't approach them appropriately, you don't maintain eye contact, a lot of that stuff happens from social anxiety. And so that's why it's common for adults to confuse social anxiety with autism. Autism is, and I always try to tell them, autism is more pervasive. It has a lot to do with how you process the world. It's not just about how you feel.
There we go.
Right?
That's a really important statement.
It is. It's about how you think and how you take in things and how you organize things in your mind. So the second whole domain is this very, very important area, which distinguishes autism, I think, from other problems. And it's called restrictive, repetitive patterns of behavior, interest, or activities. Okay, restricted, repetitive patterns of behavior, interest, or activities. Now, In this domain, you only have to have 2 symptoms.
Okay.
So 2 from here, 3 from the other, total 5 symptoms
There we
for
go.
autism. Now, I'm going to give you 4 types of areas that have to do with restrictive repetitive behaviors. This is, by the way, you guys were in ABA, they refer to it as self-stimulatory behavior, stereotypy. You hear all those terms?
Yeah.
That's here. Okay.
Yeah.
So, number 1, stereotypes or repetitive motor movements or use of objects or speech.
There we
So,
go.
simple motor stereotypies. We're talking about this or this, right? Any
Right.
of these types of things. Motor repetitive behavior.
Yeah.
Lining up of toys or flipping objects all the time, right? So that's a common one. Echolalia, repeating either sounds or words.
Yeah. Could be
Repeatedly.
lines from a movie.
Lines from a movie is kind of on the higher end, and on the more severe end is just running around and making those sounds. Idiosyncratic phrases, that's more lines from a movie. Okay. So that is one area, stereotypes or repetitive motor movements, use of objects, or speech.
Okay.
Just need one in that area.
Yeah.
Another item number 2, this is kind of section number 2 under restricted repetitive patterns.
Okay.
Insistence on sameness, inflexible adherence to routines, or ritualized patterns of verbal, nonverbal behavior. So insistence on sameness usually comes out when we see extreme distress at small changes. There's an example. Difficulty with transitions, right? Rigid thinking patterns, like everything has to be a certain way. If it's not, I'm going to get very upset about it. And this is where, in the old days, we used to say that there's an overlap with obsessive compulsive behavior and autism. That's how it looks. When you see a child with autism or an adult with autism, there are sometimes these symptoms which look very much like OCD.
Yeah.
Needing to take the same routine or same food or same clothing or those types of examples. Parents tell me, he'll never wear short sleeves, or if I change the direction I take him to school, he'll have a meltdown, or if I change the furniture arrangement at home, he'll get very upset. And the presence of those, for me, as I said on my second evaluation, I start going into causation. The presence of this type of stuff, OCD type symptoms in autism, always indicates a little bit of anxiety to me. And I note that, because then I know that I need to make the child feel a little bit safer when we start intervention.
Yeah.
Okay, so the third area, highly restricted fixated interests that are abnormal in intensity or focus. For example, really strong attachment to an object, like kids who love to carry around something and they have to have it, or excessively perseverative or circumscribed interests, like kids who will only want to talk about geography.
Thomas the Tank.
That's their thing, or Thomas the Tank. Or there are kids who will, they love taking things apart.
Yep.
Or, so that's, their focus is very, very focused on just one thing, and that's really all they want to talk about. That's it, and it's perseverative, and they do it repeatedly, and that's their thing.
Yeah.
The fourth one, hyper or hypoactivity to sensory input. I was very, very excited when this came in, because this was not a symptom before 10 years ago, and now it is. So this basically recognizes the fact that individuals with autism may have an apparent different reaction to pain or temperature, an adverse response to specific sounds or textures, which is like so important, the sensory input, right? Yeah. Excessive smelling or touching of objects, which we see very frequently. Visual fascination with lights or movements, right? The self-stimulatory stuff that we see. And so all of this stuff, I listed 4 different areas, like stereotyped motor movements, insistence on sameness, highly restricted fixated interest, and then this hyper or hyposensitivity to sensory input. Out of all those 4, just 2 areas need to be present, right? And that's really important, I feel, in the sense that you identify that there are these things present.
Yeah.
And then, of course, the other things that happen with autism, with a diagnosis. So if you have 2 in this area, 3 in the other area, and they come together, okay, you have a diagnosis of autism, okay?
But there's a couple of asterisks, right?
Yes.
Okay.
So one asterisk is that, first of all, it has to have developed early in life. In some cases, the level of functioning is so high. In other words, these symptoms exist, but the person has figured out how to cope with them, that it doesn't get diagnosed later, but it has, because later in life there's some stressful event that kind of evokes these problems. But mainly these things have to be present from, very early in life. So that's important. Second thing is that any disorder, like this is very, very important for people to realize. It's in the very first chapter of the diagnostic manual, when you get trained, it doesn't matter if we're talking about autism or ODD or ADHD or depression or alcohol dependence, it doesn't matter. Whatever it is has to prevent the individual from having a successful experience in their life. So the way that it's specifically written is, symptoms cause clinically significant impairment in social, occupational, or other areas of functioning. So what I always say is, if I'm diagnosing someone who has alcohol problems, right, dependence or abuse or whatever, they come in, they could be drinking 10 bottles of scotch a day, but as long as their life is happy, normal, in their family, at work, at school, or whatever else, I cannot give them that diagnosis. It's not considered a disorder, right? And we're talking about these things are in the diagnostic statistical manual of mental disorders. And I don't like the word disorder. I try to avoid that, but the truth is, these are things that take away from life being, you being able to thrive.
Yeah, I always think of it is that it has to be present at such a level that it's creating issues enough that they're causing you to be unhappy. Because I think most of us, especially parents, right?
Exactly.
We look at this list and we go, oh, I see a lot of myself in there. And I think there are a lot of parents over the years who have said, I might be on the spectrum, and they go to get a diagnosis. Now, some of them get the diagnosis, and I see that they go, oh, my whole world makes a lot more sense now. But a lot of people don't get the diagnosis because we don't qualify for it, and we can argue about, well, is it because we found a way to cope? But if we could find a way to cope, then it means we don't have a disorder, is how I interpret it.
Yes.
And that in and of itself, I'm just going to be honest with you guys, for both my husband and I, because we asked those questions. We were like, oh, I joked with you this morning. I said, are you finally going to diagnose me with something, right? I'll take ADHD. I'll take any, right? To explain why I can't get certain things done. I think it helps us to be rooted in a thing of saying, oh, that's why. That there is that freedom of going, oh, that's why I'm struggling. But the truth of the matter is that what I've learned is to have respect for the diagnosis.
Yes.
That I might be having difficulty with something, but it isn't I've found a way to cope, which means that what I have is entirely different than what somebody else has if they qualified for the diagnosis.
Correct.
And that I need to be kind about that and realize, wow, if I'm having difficulty, but it's not to the level
that it's interrupting my life,
then I need to think about how hard that must be for that other person.
That's right. And also, Shannon, this is why and it's really interesting, this is why I have no problem with doing ABA to help individuals with autism. There's this whole, and I'm just going to open this can of worms for a minute. There's this whole, belief system and thing that's going on now where people are like, hey, I have autism. I don't need your help. I don't want your help. Right. That's fine. I want everybody in the world to accept me as I am, which is completely fine.
Yes.
And that's totally fine based on 2 conditions. One is you actually are thriving in your life. In other words, you are at the point where you're very happy. with everything in your life. You have a job, you have family, you're not feeling lonely, you're not feeling depressed, you're not feeling anxious, you have friends, you have everything that a healthy, normal human being would. Totally fine. And the second one is that the people around you are not being disturbed. That's really important. Like I could say, I am perfectly fine having very obsessive compulsive disorder. Perfectly fine, except, sorry, but if you come in my house, you have to take a shower right outside my door before you enter. I'm going to spray you down with Lysol. You have to wear a mask. I mean, you know what I mean? And that's true too. That happens too.
Oh yeah.
So in that case, does the individual who's forcing everyone who comes into their house to take a shower, does that individual need to perhaps consider working on that issue?
Well, there are going to be consequences.
There's going to be consequences.
Eventually,
no
they
one's
won't
going
have
to
people come over.
Exactly. And so that's kind of my thing. It's like, I have a dear friend who has somewhat severe autism, right? And sometimes I go for a walk and he joins me. And it is, you know, if it's just me and him, I'm like totally telling him, you shouldn't be doing that because that just doesn't, people around you will, but he'll scream every once in a while. He'll do a very, very loud verbal screaming kind of stereotypy, right? And like people in the neighborhood are scared of him. People in the neighborhood don't want to interact with him. I'm pretty much the only one who does, me and my family. And it's like, it's very hard for him. He's lonely. That's his biggest issue. And I know that's his biggest issue because he tells me, like, he wants to hang out. But nobody wants to hang out with him because he has these behaviors.
Yeah.
And so that is my point when I talk about kind of working with individuals on the autism. The society can adjust to some extent. But in the end, if you don't become part of society, you are going to struggle. You are going to suffer. And that's why it's important to try to change some of these behaviors. It's like anything else that is in the diagnostic manual, we seek help for these things. There's nothing wrong. It's not like you cannot say, I have a disorder, but I want society to live with it, right? And I want me to live with it, but I want everybody else to adjust so that I'm happy. That just doesn't work that way. We all have to kind of work on things in order to fit into a specific society. And that's also why I don't have a problem with the word recovery, which a lot of people nowadays do. Because you talked about, you know, an individual who has some of these symptoms and they've learned how to cope. I know lots and lots of individuals who've learned how to thrive. Because they've had years of ABA and they've learned and they are totally amazing and awesome and just doing incredible things in life, more than us, you know, and just being brilliant people with wives and families and doing everything that people thought they could never do. So, and they've lost the ability to be diagnosed. So for me as a diagnostician, if you did one day fit these symptoms and one day you don't, you're recovered. You don't have these, you might have something else.
You don't have the disorder.
You don't have this disorder. You might now still have some parts of it, so I might now diagnose you with ADHD or with social anxiety disorder, but you don't have this disorder.
And your brain may still look at things in an entirely different way.
Correct.
I say this all the time, that my son's brain is so much better than mine. So much better than mine. But do you know where my son is today? He's doing jury duty.
There you go.
That's where my son is
There you
today.
go. There you go. And Shannon, think about every child that grows. Every child. When we're a child, we have a different way of looking at things. If you're a child, and we all change over time. If you're a child that is sent to math school, you will look at things completely different than if you're a child who's sent to art school. Like, so our brains adjust to society. This is very important. We learn to be part of society. Otherwise, honestly, half of us would be running around without clothing. Because that's how children are, right? The other thing I want to say before we leave is on the diagnosis, two other very important parts. One is that when you diagnose someone, you want to make sure that the diagnosis is not there are specific aspects of the diagnosis that you need to list. For example, there are individuals who might fit all of what I just went through, but they have completely normal intellectual ability. And that's important because in the past, like we had Asperger's, and that was kind of joined under this autism spectrum disorder. So there are these things called specifiers. When you give the diagnosis, you can say ASD, and then you say with the following specifiers. And the specifiers are things like, is there intellectual impairment or not?
Yeah.
Is there language impairment or not? Because you can have individuals whose language is fine, but they're still showing all the other symptoms. Is there a known medical or genetic? Now, this is very important because we're now we're coming to realize that certain genetic disorders like Angelman's, for instance, resembles autism, or if you have that genetic disorder, you will have all of these symptoms, and therefore you will get a behavioral diagnosis of autism. So now it becomes really important to identify. Listen to this, it is associated with a known medical, genetic, or environmental factor. I loved when they put that in. It was so important because, you know, there's a whole class of physicians who believe that the genetic component of autism is triggered by an environmental factor such as toxins.
Yes.
And so I'm glad that this is in here because it allows you now as a diagnostician to address that.
Yeah.
Or is it associated with another neurodevelopmental or mental disorder?
We've seen kids who've had strokes.
Yes, that's right.
Or brain
that's
tumors.
Right, that's right. And the last one, which actually is very important, and although we didn't have there's not a lot of this. This is very, very minimal. It does exist, and it is very, very devastating, with or without catatonia. And there are individuals who have catatonia. Catatonia is a very, very strange disorder that we don't know much about, but it causes the individual to freeze, literally freeze. And I remember back in currently I have 2 patients that have catatonia. Back in the 80s, 70s, when I used to do some internships at, there was a hospital called up here that closed, which was a mental hospital, Camarillo State Hospital, and there was an actual ward where there were individuals who, catatonia in those days was part of schizophrenia, and there was a ward where you had individuals who, it was called catatonic schizophrenic, and they were literally frozen for days. It was insane to see someone who has and now we see it with very, very few numbers, but it does exist within autism.
Okay.
One last thing, and I'm going on.
And then we have some questions.
I know, and I apologize, but and it's important because these are the specific things that people don't realize. There's a lot that goes into a diagnosis.
Knowledge is power.
So there's one last thing, which is there are the two domains that we just talked about, the social communication and the restricted repetitive. You have to, as a diagnostician, you have to rate the severity of the individual in those 2 areas.
Yes.
So when you have 2 numbers, when you have social communication, I can give you a rating of 1, 2, or 3. 1 means you're mild in that, you have mild deficits in that area.
However, can we, because this drives me crazy. Technically it says needs support, but at the lowest level. But what I hate is when doctors say, oh, your child's a 1, so they don't need anything.
Yes,
the very definition of a 1 means you qualify for the diagnosis, needs support.
That's right.
At the lowest level,
that's right,
but still
needs support.
Needs support.
That's right. That means, like,
crazy.
For instance, we've made some accommodations on their IEP. That is support.
Right.
So it's level 1 needs support, level 2 needs significant support, level 3 needs substantive support. So it's kind of like the amount of support increases when you're more severe, right? So the first number has to do with how much support you need in the area of social communication, and the second number, again a 1, 2, or 3, has to do with how much support you need in the area of restricted repetitive behaviors. This is important because a child who is a, let's say, 1, 3, that means they have pretty decent social communication. They don't need a huge amount of support there, but they have a lot of repetitive restrictive behaviors or sensory issues. They need a lot of support in that area. That's a 1, 3. That's a very different child than a child who is a 3, 1. A 3-1 means this individual has almost no language at all, no ability to communicate, no social interaction. But you know what? They have very, very few restrictive repetitive behaviors. They might have a little bit of sensory input issues, but not much. Those two children are very different. So what drives me crazy, Shannon, is when people diagnose and they give one number.
Yeah,
there are two numbers, and the two numbers matter.
Yeah.
That tells you the severity of the autism in each individual.
And if you get something with one number, go back.
Go back and say, I'm supposed to have a severity factor within each domain.
Either you have somebody who is half you-know-whatting it, or they don't know what they're doing.
Yeah.
So go back and ask them for both numbers. Okay, I want to get to some of these comments and questions. Autism Journey with Elijah said, "Oh, thank you both for what you give to the autism community. We're blessed." She asked a question, and this is for a friend, not for her child. "If I have a diagnosis in 2017 and we never went back to get a second opinion, we took the doctor's word. Now he's 5 years old. Would you recommend getting another diagnosis if the symptoms are getting better or worse, or is the diagnosis a firm answer?"
No, I love that question. Thank you.
And they did the ADOS test. It took 2 days and 3 hours. He's
insane.
currently diagnosed with ADHD. And then they wanted to know, somebody else said, is the ADOS the ideal test for autism?
It is. It's the gold standard test, I have to say, but it's insanely long and tedious. Okay, so yes, if it was me, and I know it's hard for parents, but the reason to get a diagnosis at that point, like it's 5 years later, or I would get a diagnosis every few years simply because if your child still has these symptoms, you want to be able to intervene. You want to be able to help your child get over or overcompensate for or learn how to cope with or just learn how to overcome some of these issues that will arise from these symptoms so that they have an easier life. Let's just put it that way, so that they can do better in life and it's easier for them. So therefore, without the diagnosis, you're not going to get the intervention. So getting the diagnosis matters only if you are then willing to actually follow up and look at it as specific as special tutoring. It's kind of like if my child's in 4th grade and they're struggling with math, I can either ignore it and say to myself, you know what, as soon as they hit middle school, I'm going to change them to an arts and crafts school and math won't matter. Or I'm going to say, I need a math tutor because my child's going to struggle with math forever. Mm-hmm. So it's one or the other. And in order to get that math tutor, you need to identify that there's a problem with math, which would be getting the diagnosis again.
There we go. Okay, want to say that both Joannie and Judy wrote in and said that Philadelphia and the Pennsylvania area are having a lot of snow, a lot of internet things, so we're glad that you could connect with us and saying hello to you all there in Pennsylvania. Sobia says, many happy returns of the day, Dr. Doreen. And
Thank
says, hello, gorgeous ladies. Hello, gorgeous, back to you. I want to get to Brian's question. Good morning, Shannon and Dr. Doreen. Happy New Year. There are new challenges with their 6.5-year-old. His IEP scores were all 95%, language past 98%, but social problems continue and more than he can't handle. This is easy. He's easily overwhelmed to the point of, for example, crying and hiding under the teacher's desk. Fear drives his problems and mirroring bad behavior from other kids. This is not good. I just want to say to Brian, so often in an IEP, we're going to be talking about IEPs a lot in the next couple of months, but in IEPs, they have this thing that they do where they'll come in and they'll give you all the test scores that are good.
Yeah.
They've been taught, I used to be a teacher, they've been taught, come in and say all the good things, right?
Yeah.
To get you all comfortable, and then to say to you, we no longer need the IEP. But a lot of times our kids are dealing with anxiety and social issues, and they can academically fly. This is a great thing, but don't let them shortchange you on the other stuff that your child needs. Now,
and I think Brian later wrote and said he's also getting evaluated for inattentive ADHD because focusing and staying on task beyond about 10 minutes is hard. Of course, he thrives on it. So I guess I want to, my initial reaction, Brian, is that it's easier to take care of the anxiety than it is to teach the language. So you're in a good place. Let's start there. His communication and skill, a lot of kids who have very, very good communication, people don't realize that there's other things going on. If I were you, I would not, this is not about going back and getting a diagnosis. It's possible that he's having a hard time attending past 10 minutes, but honestly, at his age, 10 minutes focus is not bad at all. So yes, they can do that diagnosis and that's easy, that's not a problem. But the main thing I would do is I would go and observe, and maybe not you, maybe someone he doesn't know, so that you can get a real picture of what's going on in school. Something is causing him anxiety. These are anxiety behaviors, hiding under the teacher's desk, crying and hiding. This is anxiety. Now, it could be a multitude of things. It could be it's so loud in the classroom that it's too much for him. I don't know if he has sensitivity to sound. It could be getting 95 or 98% is too much pressure on him. He has to really work too hard and he's drowning. It could be that he doesn't understand at all the social interactions with other kids, and it feels like someone's bullying him. It might not be bullying him, but to him it feels that way. Do a observation. Sometimes schools will only limit observations to like 20, 30 minutes. Do multiple observations. Find out what is causing him fear and anxiety in school. I wonder if he's doing this kind of stuff also at home, or is it just at school? Find that out, come back to us, let me know, because I hate it when our kids go through anxiety like this. Yeah. It's so important. It is so impactful in their future life and in their ability to believe in themselves and trust themselves and have self-confidence. So we need to figure this one out.
I appreciate your enthusiasm for that. We're really out of time, you guys, but I want to thank so many people for writing in. Jill says you can't possibly have been alive in the 70s. We were alive in the 60s.
I was in college. Let's we should probably try and answer some of these next time when we because we didn't get it.
I love Lucy wrote, is it possible to be reassessed and have the two numbers be lower in the reassessment than that would be conducted 2 years later?
And that's the goal, Lucy. The goal is that whatever you've been doing is working, so you're going from a 3 to a 2 to a 1, and hopefully after that, losing some of the symptoms. So yes, that's wonderful.
And Brian said, yes, very sensitive and easily overwhelmed. He will stop a simple and get upset about some. Okay.
We'll talk more, Brian. Join us next week so I can give you some pointers if it's a matter of just oversensitivity to things around him.
And he said thank you and happy 2024.
Thank you.
And I'm sorry that we didn't get to everything that everybody wrote in, but we'll continue this conversation next week because it's very, very important. I do want to say too, Joanne wrote and said that the doctor told her she didn't need the numbers. Yeah. What would you respond to that? That the report told her everything she needed to know about the child and she didn't need to know the numbers?
No, you need to know the numbers. Children who, the severity level matters significantly in terms of what you do next.
I just don't understand a doctor who would say you don't need the numbers. That feels very condescending to me.
I think it's not more, I think it's more just their education. People did not get educated correctly.
Well, there we have it. Anyway, you guys, so thrilled that we had this time with you and we went a little bit over. Thank you for that, Dr. Granpeesheh. We are back tomorrow. We are doing a Let's Talk Movies with Moira and Shannon. Lots of things. Please join us to watch the top of my head fly off about a couple of things. One that we're not even going to talk about yet. Have you seen Poor Things? It's a whole discussion we have to have.
No, I have to see it.
Oh, dear. Okay. So anyway, but Moira and I will be here tomorrow, and she's going to give you an update on some important things happening with Taka, and that's going to be really wonderful. And I think we have a huge guest next week that is going to be joining us, and I'll give you more information about that hopefully tomorrow. Until then, thank you.
Thank you.
Happy New Year.
Happy New Year, everyone.
And give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.